And now we're going to turn to babies. And babies create profound changes in the world. And one of the remarkable, I don't know, it's a side effect, I'm not quite sure, but we have seen so many babies come into the world during the course of this program. So I welcome Kimberly Bordagray to come forward, and she is presenting on improving postpartum well-being through yoga. There she is. Okay.
Yes.
Start out.
Yes, I bookended my time here with 2 children. I wouldn't recommend it. Like Dr. Chappell said, my name is Kim Bordagray, and my graduate thesis is Improving Postpartum Wellbeing with Yoga Therapy, a case series. And before I begin, I'd first just like to extend gratitude to all the faculty, especially Lori, for your encouragement. Man, hours. You know, we've learned so much from you, and I just know I'm going to be taking away so much from this program, and I'm so grateful. So thank you. Also have to express gratitude to my husband and extended family. I could not have pursued this without the time that they gave me, paper writing, reading, all the things, and just the support to see it through. It's hard to believe that I'm standing here. And then finally to Andre and Simone, the reasons that I am on this journey. So to begin, I would like to lead you all through an embodied practice. So take a moment to find comfort in your seat, either upright or reclined back in the chair. If you feel comfortable, close your eyes. I'm going to play a brief audio recording, and as you listen, I'd like you to fasten your awareness to the sensations of your body. So for example, your heart rate, the quality of your breath, maybe any tension in the body, physical sensations. When the recording stops, remain in this awareness as I guide you through a brief breath practice.
It's okay.
Shift your attention now to the cadence of your breath. On your next inhale, take a slow, deep inhalation, drawing the breath into the lungs and allowing the abdomen to expand in all directions. When you reach the top of the inhale, take a brief pause. Then allow the exhale to flow out of you, letting the chest and abdomen release. Continue with this deep breathing for several more moments. When you're ready, slowly open the eyes and come back into the space. Taking a moment now to reflect on your experience before and after the breathing practice. We'll touch base on how we were feeling after later on in the presentation, but for now, share what experiences did you observe in the physical body? Feel free to just shout out what you felt.
Heart racing, chest tension.
Heart racing, chest tension, headache,
Holding the breath.
holding the breath. Great. Wonderful. So all of these sensations, increased heart rate, shortness of breath, maybe tense muscles, if you experience that, are all examples of how our stress response system responds to a perceived threat. Now, whether or not that threat is actually a threat is irrelevant. But what is important is that if our body continues to respond in this way, the burden it puts on us can have adverse health outcomes. I have to do my slides. Okay, what did we experience? Okay, this is what happened, stress response system. Okay, unfortunately for postpartum women, the stress caused from the incessant cries of a new infant are on top of the biological and psychosocial stressors that we experience with a new infant following pregnancy and childbirth. Now, of course, this is not an exhaustive list, and not all women are going to experience all of these symptoms, but comorbidities are very common. And 20 to 30% of mothers experience lifelong complications from symptoms on this list. Additionally, untreated maternal health concerns have been correlated with negative infant health outcomes. All this to say, women are highly vulnerable the year after childbirth and are then faced with countless external stressors as they navigate new motherhood, which can then have widespread implications for their family. So how is all of this being addressed? Unfortunately, there are considerable gaps in the postpartum care system that make it challenging for us to address the multifaceted nature of the postpartum period. Typically, women have just one appointment 6 weeks after delivery, and in this one appointment, it's meant to assess the physical and mental well-being of the mother, counsel her on infant care and family planning, and detect and refer out for any chronic conditions such as diabetes, hypertension, and even obesity. Now, this is a lot to cover in 15 minutes, which is realistically how much time a woman sees her doctor. Additionally, there could be different perceptions about what could be prioritized in this one appointment. So for example, clinicians may feel that physiological complications take precedent, whereas a mother may be more concerned about how these symptoms she's experiencing are disrupting her daily life. Now, it's this gap that I believe yoga therapy can be an adjunct intervention. So the purpose of my thesis was to investigate if yoga therapy can be an effective option for addressing the unique experiences of postpartum women. Secondly, I had hoped to evaluate if a proper attention to proper breathing mechanics, that is coordination between the diaphragm and the pelvic floor, could support postpartum well-being from a physical and emotional space. Now, the trajectory of this project has been inspired by my own experience as a new mother, navigating the challenges of the postpartum period, as well as observations that I saw working with postpartum clients. Throughout this program, I have conducted research around maternal morbidities and the postpartum period. I've researched modern medical and classical yogic research to understand how the practices of yoga can support women to reach their full potential postpartum. This research then culminated with an IRB-approved case study, case series, where I worked with 5 postpartum clients over 10 weeks. Now, before I share more about this case series, let's talk about why theoretically the process of yoga therapy can be effective to support the postpartum population. First, yoga therapy uses a multidimensional concept known as the koshas to understand the full range of human experience. Each layer here represents an individual aspect of our experience. So we have our physical body, our subtle energy, our mental and emotional experience, and then our spirituality. And what's important here is that what we experience in one of these layers can affect our experience in another. So for example, pelvic floor dysfunction, which is a common symptom for postpartum women, is a biological experience, but it can impact a woman's quality of life and affect her mental and emotional well-being. Given the unique experiences that each postpartum woman has, as well as the multitude of symptoms that can occur after childbirth, I argue that the koshas and the process of yoga therapy are an ideal process for addressing maternal needs and concerns. Secondly, from the yogic perspective, there are 4 phases of disease. Modern medicalized care focuses primarily on reacting to the somatic and organic phases. So these lower 2 phases here, and they're reacting to it, reacting to the disease, whether it's become manageable or irreversible. Yoga therapy, while useful in any one of these phases, is most effective at addressing the psychic and psychic somatic phases. And to do that, they are looking to prevent disease. Traditionally, the practice of yoga was intended to control these diseases of the mind. Postural yoga, which is what modern culture typically associates yoga to, is just one modality of many that can be used to address the fluctuating thoughts and our perception of stress. Pranayama, or breathing techniques, are another. According to Patanjali, a calm and clear mind is attained by the exhalation and retention of the breath, which is achieved physiologically through proper diaphragmatic function. So now, returning to our experience from the beginning of the presentation, just take a moment to remember any shift or change you may have experienced after taking several deep breaths. So why is this important for postpartum women? In my thesis, I discuss how the diaphragm impacts many biological processes, including our stress response system. I explain how the diaphragm becomes weak after pregnancy due to the growing fetus, and that attention to it can help improve many postpartum symptoms. Additionally, helping to reestablish the diaphragm's coordination with the pelvic floor may help to support postpartum women during this time. So this brings me to my case series, which I had hoped to test this concept. However, very early on, it became clear that private sessions may not be the best format for sharing this material. Because these were individualized sessions, I had to prioritize the needs of the mother over my own research goals. Diaphragmatic breathing was incorporated into all of the sessions, but coordination with the pelvic floor was not always successful. And this was for a number of reasons. Lack of interest or understanding, conflicting priorities, as well as how I presented it. Still, my research does highlight the benefit of using an individualized approach to support a wide range of postpartum experiences. So as you can see here, there were several different symptoms that were present throughout this case series, including pain, fatigue, depression, anxiety, stress. And all 5 of these women experienced more than one symptom. So I'd like to highlight now 2 cases to show you guys how different each of their experiences were, and therefore their yoga practices. Here is a snapshot of case 4's KOSHA assessment. Now, this mother demonstrated clear signs of a weak diaphragm. Her secondary respiratory muscles, so her neck muscles, activated with each breath, and she primarily breathed from her chest. Initially, she volunteered for this case series, hoping to establish a physical yoga practice, but it became very clear early on that this wasn't going to be feasible for her, given her current circumstances. Her son was very active and present in most of our sessions. She was also very insecure about her new role as a mother, and she just could not prioritize learning and practicing new techniques. Additionally, while she was very aware of her mental and emotional health, she primarily operated through the monomaya kosha, our mental sheath, making it very difficult for her to connect with her physical body. Given all of this, her yoga practice evolved to include embodied play with her infant, and including practices like crawling and mirroring her son's movement. And towards the end of the session, introduction to body scanning meditation also resonated with her analytical tendencies. Alternatively now, case 5's main concern was pain in her neck, shoulders, and upper back. Between exclusively breastfeeding her child and co-sleeping with her baby, her shoulders were in constant internal rotation, leading to significant pain and significant and ongoing pain. This mother presented very balanced across all other aspects of her being, expressing joy, confident, and even low to no perception of stress. Her yoga practice was more of a sequence of postures and dynamic movement, and we had a strong emphasis on incorporating the breath. So clearly these women had two very different experiences, but through the process and personalization of yoga therapy, both of their needs could be addressed. Finally, overall, significant improvements were seen across several assessments in this case series, including maternal function, balance time, pain, perceived stress, and the impact of pelvic floor symptoms on life. So while I was forced to let go of my initial research goals of utilizing the breath to support postpartum well-being, the individualized intervention still had a significant impact on the lives of the women that I worked with. This suggests that yoga therapy is a promising intervention for women navigating the hardships of early motherhood. During a time when women can feel neglected and alone, one-on-one yoga therapy can meet them where they are, help them cultivate the grace and compassion and self-care that they need to improve themselves and move through this challenging yet joyful time in their lives. Thank you.